Hey there, and welcome to Lunchtime Live with the Center, where we talk about important fertility-related topics to support and inform your journey to having a baby. My name is Ami Choksi, and I'm your host. Now, the financial aspect of fertility treatment can be a source of stress, but at the center, we have specialists dedicated to helping you navigate the ins and outs around paying for your fertility treatments. So today we're talking to Christine Guarda, who is an expert at this topic. She's been with the center for over 20 years and is the lead financial services representative. So she's well versed and able to guide patients through the often confusing world of fertility coverage and paying for treatments. So, Chris, welcome.
Thank you so much for having me.
You're welcome. And so last week we talked to Dr. Schmidt about what happens when you're a new patient. And he said that a financial services representative is a key component to the visit. So can you talk a little bit about, or talk us through your role in this new patient visit?
Oh, absolutely. Thank you. So essentially, what a patient will do is they'll have their conversation in their telehealth appointment with the doctor. After that happens, they will have a conversation with one of our team on the financial aspects of the program. So we'll take that opportunity to review the information that we were able to obtain from the insurance company as far as benefit coverage and kind of review that with the patient and kind of compare notes, if you will. Look to see what the patient was told when they phoned for infertility benefits and kind of just go from there. We will then address any of the particular tests that are going to be required,
Mm-hmm.
whether those are covered, if there's any anticipated out-of-pocket expenses that we're seeing for those services. At that point, too, we'll also review prior authorization processes if required, what the expectations for that are, and kind of go from there. Schedule any appointments that are required. And at that point, after that happens, then they'll have a conversation with their medical team to make sure and ensure that they understand the information that was reviewed to them with them by the physician.
Okay. You mentioned compare notes. What do you mean by that? So are you saying that, well, what do you mean by compare notes?
Well, we really encourage patients to phone their insurance companies, inquire what their benefit is, because this is an opportunity for us to have a shared journey, if you will. We're here to assist patients in that opportunity, and it really does make a difference when the patient calls, obtains their information. If one of us is told something that just doesn't match, if you will,
Mm-hmm.
then we stop, we halt things, we review the benefits, making sure that we try to get the best information that we possibly can before the services are rendered so that there is an expectation of what the financial outcomes are going to be for them.
Okay. So what type of questions would you suggest, when they're calling to learn about their benefits, what type of questions should they be looking to ask and know?
Actually, starting with our referrals required to a specialist office.
Oh,
If so, please, that's the opportunity for them to reach out to their primary care doctor, the referring doctor, to obtain that so that their first visit is actually covered. Simply, our deductibles required for services, whether that be going to the doctor's office or outpatient services. Our
mm,
pharmacy, um, the pharmacy aspects of the program, do those also attach to that deductible? Is there co-insurance? Is there, does that doctor's office fall into their tier one or tier two? What does that mean for them and what their amounts out of pockets are going to be? Also, just what's covered for infertility. Do I have testing coverage? Do I have IUI coverage or IVF coverage? Simply by just asking, what is my overall benefit for infertility? That
okay.
will really kind of, just ask for all of it: testing, treatment, medication coverage, finding out if they have a separate pharmacy vendor, so that we have that information accessible so that could be reviewed with our financial counselor at that time of the appointment.
Now, are you involved? So I know that you talk to patients in the beginning. Are you involved through the whole process?
Yes,
Um,
we are.
okay.
Yeah,
So diagnostic and fertility and as treatment cycle throughout
that's
the whole time.
yeah.
Well, can we talk a little bit about what's the difference between a diagnostic cycle and a treatment cycle?
Sure. The diagnostic process is when you're actually a patient's coming in being worked up,
Hmm.
whether that's for hormone profile levels, semen analyses, HSGs, sonohistograms, the basic workup to define what the potential diagnosis will be. And then
Okay.
when a patient gets to treatment, that's where they would enroll into the IUI program or in vitro fertilization program, or if they needed third party also.
Okay. Then, eh, are you involved, if there are discrepancies with the patient, with the patient's insurance, do you call on behalf of the patient? I mean, will you fight for, like, on a patient's behalf if need be?
Oh, absolutely. We do our best that we can for our patients. I mean, it's really near and dear to our hearts. I mean, our goal is
Yeah.
to just allow that patient, at least on the financial aspects of everything from my end, just to make sure that their visits here are out of pocket expenses are talked about beforehand, authorizations are obtained in, the best abilities that we possibly can as far as time wise. So we are here to help, and we do want to help.
And, so can an insurance company, like, can they limit the amount of treatment that someone receives?
Um, yes, unfortunately, it really comes down to the actual employer and what they've evaluated for the patient's benefit.
Okay.
So there are some patients that have lifetime maximums. So
Hmm.
one of the biggest questions that we recommend to the patients phoning, and sometimes it's really good to phone once or twice and look to see what their benefit documents say if they have it in writing. But if there is a lifetime benefit, does that include all of the infertility services? Does it include the medication expenses? So having that information
Hmm.
really in writing is going to be beneficial to the patients.
Okay.
But if for some reason, if something were to come back not covered or denied by the insurance companies, yes, our medical team does work together with our department. We review everything. If an appeal needs to be submitted, we do that. If a peer to peer needs to happen, we try to do that as well. So, yes, we do follow, we try to follow through.
Oh, that's great. Um, can you talk a little bit about, so in the US, there are several states that do offer coverage, and then there are those that don't. Can you talk a little bit about the Connecticut mandate and how that works?
Yes, we're very fortunate. As of October of 2005, Connecticut became a mandated state. So it gives the opportunities to patients to potentially have coverage for four ovulation induction cycles, three insemination cycles, and two IVF cycles based on
Mhm.
their unfortunate, so it does require authorizations and things, but there is an opportunity of having that potential benefit as long as it's not a self-insured policy.
So, so do all companies offer this if you work for a company, or is it possible that some companies don't?
It is possible that some companies don't, especially the self-insured companies.
Okay.
They sometimes will have their own infertility benefits, sometimes good, sometimes not so good. But there are, so it's really important to check with your insurance carriers, check with your benefit advocates for your through your employers to see what they offer for infertility coverage. And
Okay.
coming up, January is a big restart year. I mean, so a lot
Mm.
of us are getting our information from our employers about, new insurances. Here's the time to sign up, switch plans, so on and so forth. So, this is the opportune time to reach out to those departments, attend those webinars, and ask the questions: what are going to be accessible to me for infertility benefits? What are my deductibles going to be? What are my expectations available to you? Inquire with your benefit administrator: is there a telephone number for somebody I can contact at the insurance company?
Okay. Um, and there's a question, can there be coverage differences between diagnostic and treatment cycles?
Yes, there could be. There are some insurance companies that will only cover to diagnose. So whether the patient's diagnosed with their
Hmm.
OB's office here, after their first appointment, unfortunately, that could terminate their coverage moving
Okay.
forward.
Okay. So let's turn then to what if there isn't coverage, and what are some options that patients have if they don't have insurance coverage?
Well, here at the center, we have these wonderful plans that we refer to our possibility plans. And that could be starting with a new patient visit and all the way up to doing advanced treatments cycles
Okay.
here at the center. And so those are devised for patients who are put in that unfortunate category of being out of pocket and self pay, but those are here to help with some discounted expenses.
Okay. And can a patient also buy insurance on their own?
That is a great point. There's another avenue too. Patients can also look at Access Health right now. Is that time frame to enroll and see what their options are to obtain and purchase insurances? And some patients will also reach out to private insurance companies to look to see if they can purchase their own policies um,
Okay.
to see if that can be assisted and see if they qualify for any infertility coverage through that avenue.
And is there anything specific that they should be asking those plans, or when they're looking for coverage, or is it similar to what we already discussed?
Yeah, it's very similar. I would encourage the same types of questions to be asked. And, unfortunately, sometimes we're phoning and we talk to that one person who can't give us that information. But it's
Hmm.
it's important to either call back, ask to talk to a supervisor. I mean, these are valid questions that we want answers, and you deserve answers. So sometimes, unfortunately, it does take one or two phone calls to get that. But I would say
Okay.
best advice: stay persistent.
Okay. And another question that has come up: why are some services covered in an OB/GYN office but not at at the center, at the REI office?
Yeah, so we here at the center, our physicians are reproductive endocrinologists and fertility specialists. So this is why you are coming to see us.
Hmm.
So services here at the center are all really pretty much infertility related. So they're going to have the infertility diagnoses.
Okay. So some would be covered because it's a fertility specialist, and if they don't have fertility coverage, then it wouldn't be covered. But at an OB office, it might be a little bit different. Is there
Uh,
anything? Is
yeah,
that right?
it really depends on what the diagnosis that the physician is actually utilizing
Okay.
for their care, and that's what's really gonna determine the benefit coverage or what the patient has actually rendered for testing. So it's a bigger picture, just depending on the diagnoses of the reason why that the patient's coming in.
Okay. Okay. Um, so what can does Connecticut offer any sort of loans or grants to residents also?
So Connecticut has a wonderful grant program called the Nest Egg Foundation.
Mm,
So that is definitely something that can be utilized, and we actually have information on that program on our website that you can access to try to help you navigate and go through the application process.
do you know how often they select someone to receive the grant?
Typically about 2 times a year.
Okay.
So they
Okay.
do have open application processes. So it's definitely worthwhile checking back if the application is closed. Keep checking the website so
Okay.
that you can apply.
And so are there any other ways, like, can patients use their HSA accounts, their FSA medical spending accounts, and what are some of the benefit? Is there a benefit to using that?
Oh, that's also a great point to bring up. So again, right now is enrollment time. So now is the time to really look into funding those flexible spending accounts that are offered, for out-of-pocket expenses that can be utilized for services, whether it's medication
Mm,
or other services also. So definitely looking into that FSA account information, checking what the exclusion criteria are and seeing whether or not that would fit your needs. Also, there's HRA accounts, which is the health reimbursement accounts. There's HSA, which is the health savings accounts. So
hmm.
those primarily are pre-tax dollar accounts that will help maximize your dollar.
And so, because they're pre-tax, that's great. What are, what are are there some tests that patients could take before the end of their end of the year to maximize their benefits, their current insurance benefits?
Right, maximize benefits and their time. I mean, if they're looking forward to proceeding with treatment, but they need to wait till the end of the beginning of the year because they're not going to make it in time to start their cycle. Perhaps doing all the preliminary workup, the testing, the sonohistograms, the
Mm,
hysterosalpingograms, which are the HSGs, blood work to evaluate hormone profiles. So testing, absolutely. I mean, that'll definitely be beneficial to them and helping them move forward in a more timely fashion when their new year comes around and they can actually get started with their treatment cycle.
okay. There's a question from Remo. What's the best way to figure out of pocket costs for IVF when we do have insurance with some coverage?
With some coverage. So that's where your financial counselor is going to help navigate you through that process. So basically, we are going to take a look at a couple of things. So we're going to take a look at the treatment plan. Where if your plan requires an authorization, we're going to secure that authorization.
Mm-hmm.
Once we receive that feedback from the insurance company as far as what services are being covered, we're then going to check your deductible, see what's applied, recommend that once your medications are processed, give your financial representative a call so that we can recheck the benefits before you actually get started, so that we can have the discussions. What are the
Mm-hmm.
expectations financially before you start your cycle? And I can't stress that
Okay.
enough. Having an open line of communication with your FSR periodically, anytime something changes throughout your cycle, the doctor's talking to you about another procedure or test that needs to be rendered, reach out to that financial counselor so they can help you.
Okay. Yeah, you guys do amazing work, and really it's wonderful to have someone like you to guide people through this, because there's so much information, and there's already this other stuff that you're going through and dealing with, and to have you like really hold patients' hands through it is, I mean, it's just a wonderful service.
Thank you.
You're welcome.
We're always happy to
Um,
help.
Yeah. And do you ever talk to people before they make an initial appointment?
Yes, I mean, if somebody had a question that they wanted to reach out to a financial counselor, absolutely give us a call. We're here to help and try to help you with your questions, excuse me, and answer those questions for you. If we
Okay.
don't know the answers, we will try to reach out to your insurance companies to help navigate that process. If you're even having a difficult time just kind of determining whether or not you even want to make that first appointment and that first step towards infertility treatments and testing.
Chris, is there anything else that you'd like to share? I mean, you've been with the center for over 20 years. It's amazing. Is there anything else that you've seen what they go through in this process, and the process as a whole? Is there anything else you'd like to share with them that could be helpful?
I can't encourage enough calling the insurance companies,
Hmm.
inquiring about where your benefits are so that we can all start on the same page together throughout this journey. I think that's just the best information. Knowing, trying to compare notes is really key with your financial counselor.
Okay.
If
Well,
there's any discrepancies, talk about it.
stay open with the communication, and
Absolutely.
yeah, and I love the idea that they call, you call, and you compare notes so that there are no, um, there are fewer mistakes, or whatever.
Right.
um, all right, Chris, thank you so much for sharing your expertise. It's been a pleasure.
Oh, you're welcome. Happy to help.
Yeah. Okay. So we'll be back next week with another Lunchtime Live. And be sure to check out our website as well at yukonfertility.com for additional information, as well as a calendar of events to support you and help you feel connected. See you next week.
Thank you.